Welcome in this channel, totalphysiology.com. Video channel is Vijay K Videos. Today's topic is, today I am going to talk about estrogen. Estrogen. Estrogen is a steroidal hormone, steroidal sex hormone that exists in three forms. First, 7-beta estradiol. Estradiol. This is most potent. Then estrone. And third is estriol. This is 17-beta estradiol is most potent. Then estrone is intermediate effect, and third is estrol. These are the types of estrogen. Now coming to site of synthesis. Site of synthesis. Number one, theca interna cells. Cells of theca interna of Graafian follicle. Theca interna cells. Internal cells of Graafian follicle. These cells have large number of LH receptor and they secrete more estrogen. Number two, granulosa cells of Graafian follicle. Then placenta, third, placenta, adrenal cortex, which layer? Three layers are there, zona glomerulosa, then zona fasciculata and zona reticularis. It is segregated in zona reticularis, and fifth is testis. Adrenal cortex, zona reticulata and testis contributes or secrete very little amount of this estrogen. This is site of secretion. Now coming to biosynthesis. It is derived from cholesterol. Cholesterol is the main source. Then from cholesterol, pregnenolone, and after that 17-hydroxypregnenolone. This is converted into dihydro androsterone. This is converted into testosterone. And then estradiol is formed. From cholesterol to pregnenolone, 17-hydroxypregnenolone, then dihydroepiandrosterone, testosterone and finally estradiol. This is biosynthesis of this estrogen. Now coming to normal level. What are the normal levels? Normal levels. Before puberty, only less than 35 microgram per day. During puberty there are two peaks. First, start of ovulation, just before ovulation. At this level, what is the level? 250 to 500 microgram per day. Then second, in mid-luteal phase. Two phase occurs. First, just before ovulation, it will go to the 250 to 500 microgram per day, and then mid-luteal phase. In mid-luteal phase, it again rises up to 250 to 500 ml, 250 to 500 microgram per day. After menopause, it again becomes less than 35 microgram per day, and in male also its level is only 35 microgram per day. This is the normal level. After secretion, this enters into bloodstream and will go to the target cell. Now coming to mechanism of action. Mechanism of action. Mechanism of action. This is a steroid hormone, therefore it enters easily into the cell. It will go to the cytoplasm where there are two types of receptors, estrogen receptor alpha and estrogen receptor beta. Estrogen receptor alpha is present in uterus, mammary gland and pituitary gland, while estrogen beta receptors are present in ovaries, prostate, CNS and blood vessels. Estrogen receptor alpha is present in uterus, then mammary gland and pituitary gland, while that of estrogen receptor beta is present on ovaries, prostate, CNS and blood vessels. This will enter into the cell and estradiol will enter into the cell. This is cell wall, cytoplasm. Cytoplasm is there and this is nucleus. Suppose this is nucleus. Estradiol will combine with its receptor, estrogen receptor alpha or estrogen receptor beta, and then it will enter into the nucleus, where it will cause formation of mRNA. Messenger RNA from DNA, it will form messenger RNA, and this will produce multiple types of proteins that will work. This is mechanism of action. Now coming to function. Metabolism. It is metabolized in liver, where it is conjugated with sulfate and glucuronide, becomes water soluble and then excreted mainly in urine and to some extent into the stool. This is metabolism. Now coming to function. What are the functions of estrogen? Estrogen is mainly responsible for maintenance, development and maintenance of secondary sexual character and secondary sexual character and development of development of development and development and regulation of reproductive organs. Reproductive organs. Female reproductive organ. And second function is development and maintenance of secondary sexual character. Secondary sexual character of female. Two functions are there. So target organs are number one, uterus. Number one, uterus. It causes increase in the size of uterus. Increase in size of uterus. Then fallopian tubes. On fallopian tubes, it causes increased motility of fallopian tubes. Muscles of fallopian tube, a smooth muscle will contract and these helps in movement of sperm towards ovary. So uterus, number one uterus, number two fallopian tubes, then coming to vagina, it causes development, keratinization of conification of vaginal epithelial cells and help in secretion, vaginal secretion. Number three, mammary glands. Oh, mammary glands. In mammary glands, it causes development of mammary glands by increasing stromal cells and lactiferous ducts, alveoli etc. Then coming to, these are the site of function of estrogen. Now coming to blood vessels. Blood vessel. It increases, it causes vasodilation. Vasodilation. Number two, metabolism. On metabolism, it lowers cholesterol level. Lowers cholesterol level. On blood, it causes increased formation of blood coagulation factor leading to thrombosis, may cause thrombosis. On blood vessels, metabolism and on endocrine glands. Endocrine glands. On endocrine glands, it increases formation of synthesis of LH and FSH, thyroid hormones, thyroxine and glucocorticoids. Its effect on LH and FSH is complex. When estrogen level is low, estrogen level is low, it inhibits LH and FSH secretion. When its level is high, it will increase LH and FSH. When estrogen and progesterone are both high, then it will cause decrease of LH and FSH secretion, which is responsible for effect on ovary. One thing I am missing, that effect on ovary. On ovary, it is responsible for ovarian cycle, maintain ovarian cycle. It is responsible for help in pregnancy and its maintenance and in maintenance. It is responsible for ovulation as well as for corpus luteum formation. This is about function of uterus. Now coming to its clinical use. What are clinical use? Number one is hypogonadism. Number two, dysfunctional uterine bleeding. Number three, in contraceptive pills. In combined contraceptive pills, estrogen is present. Then coming to hypogonadism, dysfunctional uterine bleeding, and contraceptive pills. These are main functions of clinical use of estrogen. It causes hypogonadism, used in hypogonadism, then it is used in dysfunctional uterine bleeding and in contraceptive pills. These are functions of estrogen. So in this video, we learnt about what is estrogen. Estrogen is a steroidal sex hormone. Then types of estrogen 17 beta, estradiol, then estrone and estriol. These are the types. What is definition? Then types. Then we learnt about synthesis of estrogen, then site of synthesis, steps of synthesis, then site of synthesis. What are the sites? Number one, theca internal cells of Grecian follicles, granulosa cells of Grecian follicles, placenta, adrenal cortex, zona reticularis, and testis. Then site of synthesis, then normal levels of estrogen in blood. Then metabolism and mechanism of action. Target cells and functions. Target cells and functions. Target cells and functions. Then clinical use. Of estrogen. So I think I explained many things about, not all, but many things about estrogen, and I think this will help you in general practice, day-to-day practice, and for a student it is especially important in examination point of view. So thank you very much. Please like, subscribe the channel and follow me in this video, and please give a comment. This will help to improve my video. Thank you very much.